Hello and welcome to the latest installment of the Positive Psychology Leader Series brought to you by the International Positive Psychology Association. We have a great program for you today. We have Felicia Huppert from all the way in Sydney, Australia this morning is with us. She's having her coffee or her tea with us as we get started to talk about mindfulness and compassion as foundations to well-being. I have seen a preview of the presentation, so you're in for a treat. So we're really glad to have you. I'm David J. Paulet, and I'm the founder and director and host of the Positive Psychology Leaders Series. I'm honored to be so. We're in our 10th year right now, which is quite something. Time has flown by. I'm an executive coach and the author of 2 books, The Law of the Garbage Truck and The 3 Promises, and I'm also a graduate of the Masters of Applied Positive Psychology program at the University of Pennsylvania. And so it's, again, really an honor to be with you. A couple of things just to tell you for those joining us for the first time. Boy, we're really happy to have you with us. This is a chance. This series was created to give you the opportunity all around the world. We have members from all around the world. Give you a chance to get up front and close with the leaders of the world in research and positive psychology and also key practitioners. And it's a chance for you to ask questions directly in a members-only environment. In fact, only members have access to this program, and so we're glad to have you today. We really are. A couple things just to share with you. As we mentioned, we are in the 10th anniversary of the program, and a couple things that are going to happen this year. We'll have some more updates from past presenters. We've had really just great folks from around the world who've presented for us. Some new international speakers, some extended question and answer sessions. We've done that before where we've had a whole hour dedicated to just your Q&A. We'll have some special guest hosts as well, and some book giveaways and more. In fact, talking about book giveaways, just to get the juices flowing, the blood flowing through our veins, the first person who can type into the question part of the webinar control panel, there's a little question box there. The first person who can answer, where is the 5th World Congress on Positive Psychology going to be hosted this year? They'll win a copy of my book, The Law of the Garbage Truck. I'll personalize it and we'll send it right out to you, no matter where you are in the world. So if you know where the 5th World Congress on Positive Psychology this summer is going to be located, type that into the question box, and we'll be glad and fun spirit to get a book right out to you. I also want to mention to you that we want to hear from you, and so on social media, with Twitter at IPANET, or on our Facebook page, the International Positive Psychology Association. We love hearing your recommendations for presenters, your feedback on the program. Some folks have really had some breakthroughs in terms of what they've learned on the program or the contacts they've made, and we want to hear your stories too. So please don't be shy and come on and let us know. This is our 39th episode, and so one of the things that we want to tell you is that this episode today with Felicia Huppert will be recorded and will be in our members-only vault. So this is a library of recordings of all the presenters over the last 10 years. So if you're doing a history of positive psychology, boy, there's a lot in there that you can get. It's audio access. Many of the presentations, the PowerPoint presentations, are in there as well. And just terrific presentations. So take a peek when you can. And just early next week, we'll have a copy of this webinar ready, or a recording of this webinar ready for you. So you'll be able. So if Felicia is moving quickly and it's hard for you to take notes, sit back, relax, and just know that you can get at the presentation early next week and at your leisure take notes in the way that you want. Questions are really encouraged. So there is a little box on your webinar control panel for questions. And as you have them throughout the presentation, go ahead and type them in. If you can keep them sort of brief, that's helpful for us. And let us know where you are, because we like to recognize people from around the world. All right, good stuff. I have to tell you one thing, though, before I get started. Usually this is what I share at the end, but I have to just tell you there are 2 people who help make this program work, and they do a ton of work to make it come together. And I just want to recognize our series producer, Jenny Brennan, and our technology director and social media director, Sydney Rubin. They're just absolutely fantastic, and it makes this program just a pleasure to run. It's an all-volunteer program that we do here for IPA, and we're sure glad to have you. So without further delay, I'd like to introduce you to our special guest, who's someone that I met a whole bunch of years ago. Not to say that means we're still young, but we were younger then. And she just was a big leader in the field of positive psychology. Then her esteem has only grown over the years, so let me introduce you to her. Professor Felicia Huppert is internationally renowned for her work on the science of well-being and the promotion of human flourishing. She holds a professorship in the Institute of Positive Psychology and Education at ACU in Sydney, Australia, and spends part of the year in the United Kingdom, where she is director of the Wellbeing Institute at the University of Cambridge and emeritus professor of psychology. She advises the UK government, that's correct, she advises the government and international bodies on the measurement of well-being and on policies to enhance well-being. Her research examines the causes and consequences of well-being using data from large population samples, longitudinal cohorts, and intervention programs. Felicia's current research focuses on three main areas. One, major studies on the effects of mindfulness training for both teachers and students, so important. A Templeton-funded project on well-being and compassionate care in a healthcare setting. Wow, another super important effort. And analysis of the effects of the global financial crisis on well-being. Wow, she is in the mix of some very important things. 3 books just to point out. If you don't have them on your shelf, you may want to grab them. One is called The Interventions and Policies to Enhance Well-Being, Volume 6, Well-Being, a Complete Reference Guide. That's by Wiley Blackwell. And then with Alex Lindley, Felicia wrote a book called Happiness and Well-Being. It's a 4-volume series with Routledge. And then Felicia wrote a book with a number of other authors called The Science of Well-Being with Oxford University Press. So I could go on and on about her background, but I can just tell you from knowing her, she is a delight and a wonderful person and a great ambassador for positive psychology. It's my pleasure to welcome Felicia Huppert. Hello, Felicia.
Hello, David. Thanks so much for that introduction. And especially
you're welcome.
And thank you for the opportunity to present this webinar.
It's terrific. We're glad to have you.
Thank you. So my title makes a fairly bold claim that mindfulness and compassion are at the foundation of well-being. And what my hope is that by the end of this presentation, when we've discussed the background and the research evidence, that you may feel the claim is justified. But I feel that where I need to begin really is explaining what I mean by well-being, because different people have different views. For some people, well-being is primarily about positive emotions, such as happiness, and that's the hedonic view. For others, it's more about the way we function in our lives, and that's a more eudaimonic view. But my own belief is that it's about both. It's a combination of feeling good and functioning well. And of course, there's a reciprocal relationship between those. Feeling good helps us to function well, and functioning well makes us feel good. So that's the sort of general approach that I take to well-being. But what are the main components of well-being? Because if we want to improve it, we need to know what the components are. We need also to be able to measure them. So many different scholars in the field have their own list of what they regard as the main components. But my student, Timothy So, and I thought we'd like to try to take a systematic approach to identifying what the key components are. And the way we went about this was to look at something we call the mental health spectrum, which is the idea that we all lie somewhere along this spectrum. At one end, there are the common mental disorders, and I do stress common: depression, anxiety, the disorders that any one of us could have. At the other end, there's flourishing. And at any one point in our lives, we lie somewhere along this dimension. Sometimes we feel so bad and function so poorly that we reach diagnostic criteria for one of these common mental disorders, and we actually get a diagnosis of depression or anxiety. At other times, we might not meet criteria, but we might just be languishing, that's Corey Key's term, nice term, just not functioning well in our lives. At other times, moderate mental health, other times, hopefully more often, flourishing. Now, the point is that we see flourishing as the opposite end of the spectrum to the common mental disorders. And what we could do is learn from many, many decades of work from the clinicians about the symptoms of the common mental disorders. So we could look at the symptoms and take their opposite. And that's what Timothy So and I did in a paper published in 2013. Let's take an example, major depression. So among the symptoms are loss of pleasure, loss of interest, feelings of hopelessness and pessimism. So we took the opposites. So positive emotions, interest and engagement, optimism. And we did that for all of these symptoms from the DSM category, from the International Classification of Disease, ICD as well. We listed the psychological symptoms and took their opposite. And this led to these 10 dimensions of well-being or features of flourishing. Now, if you look on the left-hand side, you'll recognize PERMA, very, very similar to Martin Seligman's idea of positive emotions, engagement, relationships, meaning. We prefer the term competence to accomplishment. But there are 5 others that seem to be quite important in this idea of positive mental health or well-being or flourishing, and they are resilience, and emotional stability, and this mental vitality, also optimism and self-esteem. So the important thing is to recognize that well-being is multi-dimensional, and when we think about measuring it, when we think about improving it, we need to think about the dimensions that are affected in the people we want to help, but also the dimensions that respond to change. Now, we've done some very major studies across Europe showing that if you take a measure like life satisfaction, you can look at countries that have identical measures of life satisfaction, and yet their profile on these many dimensions is utterly different. So the implications are, if you want to improve well-being in one country or one group, you may need to go about it in a slightly different way to how you do it in a different country or a different group. So turning now to what we do know about the determinants of well-being and the interventions that improve well-being. Some years ago in the UK, the Government Office of Science commissioned a very large 2-year study to look at the determinants of well-being and interventions to improve it. It used many hundreds of experts, made very detailed state of the science reviews and so forth. But they also wanted to be able to engage with the public and give them the headlines from all of this immense amount of work. And they commissioned the New Economics Foundation to come up with the 5 ways to well-being. In other words, the evidence-based 5 top actions we can take to improve our own well-being. And here they are. These are actually photographs of the postcards that the New Economics Foundation put out. So don't try and read the small print, but you can actually buy the postcards if you want them. So we begin with connect, and that's about our relationships. We all know how hugely important our relationships are, and the evidence is very, very clear on this. But many of us don't take the time in our busy lives to connect in the ways that we know would be good for our well-being. And then the next one is be active, and there's very good evidence that physical activity is as important for our mental health as for our physical health. It actually is a very powerful antidepressant, for example. And then the third important action was take notice. Pause in the middle of our busy lives to just notice what's going on around us. Notice the passing clouds, the smile of a child, the smell of coffee. Another name for that is being mindful. And then there's keep learning, and keep learning increases our well-being for all sorts of great reasons. It's engaging, gives us a sense of self-esteem, helps us connect with others, and so forth. And finally, give. Now, many cultures and faith traditions have recognized the importance of what we do for others, whether it's giving money, giving help, even just encouragement or smiling at a person. And they've recognized that giving is more important for our well-being than receiving. And this is very much supported by the scientific evidence. So I'm going to focus now, though, on the middle one of these, take notice. And the reason is I think it's fundamental to the others, because if we do take notice of what we're doing, everything else we do can benefit. If we connect in a mindful way, if we exercise in a mindful way, things are going to go better. Our connections will be deeper and more meaningful. Our exercise is less likely to harm our bodies, and so on for keep learning and give. Whatever we do, if we do it in a mindful way, it's going to be better. So let's look at this thing called mindfulness that's gaining so much popular attention at the moment. And it's really very simple. It's just a way of paying attention to what's going on right now in our minds, in our bodies, and in the world around us. And it has a lot of benefits. It allows us to listen deeply and to see clearly. It allows us, in the course of our busy minds, our busy world, our busy lives, to slow down and simplify things. And who of us wouldn't welcome that? It leads to a greater understanding of whatever it is that we're experiencing. And that in turn can lead to better choices and better decisions. But what is mindfulness training? Well, I'm going to think particularly about the secular forms of mindfulness, mindfulness-based stress reduction or mindfulness-based cognitive therapy, which are wonderful eight-week training programs that teach us certain very basic skills. One of them is noticing what's going on in our bodies, and a lot of us are not very good at that, but it is really helpful to notice where in our bodies we're experiencing certain things, whether it's pain, tension, pleasure, whatever. It's a very helpful thing to be doing. Another is focusing on our breath, just noticing the breath as it goes in, as it goes out. Perhaps noticing the coolness of the breath at the tip of our nostrils as we breathe in, the warmth of the breath as we breathe out. Perhaps the very slight rise in our bellies as we breathe in and the deflation as we breathe out. Now, meditation can sound a bit scary, but in fact, the meditations can be as short as a few minutes or up to an hour. But even short meditations, short periods of focusing on our bodies, our breath, or listening to sounds in a very open manner, even short periods can have a very calming effect and a very beneficial effect. And I just want to look at what are the basic skills that are trained in these mindfulness courses. Well, the first one, as I say, is awareness. We actually spend a lot of our lives on automatic pilot, not even noticing what we're experiencing. So becoming aware of what we're experiencing is quite a profound shift. And then paying attention to it, whether it's the body, whether it's the breath, whether it's sounds or other things, whether it's movement, paying attention. And the thing is, when we try to pay attention, what we notice is that our minds wander. And we need to bring our minds back to whatever it is we were trying to pay attention to. And we do this in a very kind way, but we may do it hundreds of times, even in a few minutes. And it's a wonderful way of training our attentioning, noticing where our mind has wandered and gently bringing it back to whatever it is we were trying to be attentive to. And another part of the training is a perceptual shift, which allows us to step back from our experience, not be caught up in the drama of our lives and swept away with it, but actually stepping back and noticing what's happening to us. And that leads to a reduced reactivity or non-reactivity. So when we do have a strong emotion like anger, instead of lashing out or yelling at someone, maybe even hitting them, we notice the feelings in our body that are associated with the anger. We notice what's going on in our minds. And it allows us to step back, not react to the anger, but to respond in the way that is actually more appropriate. And all of that is related then to self-regulation or emotion regulation, which is a very important aspect of our well-being, being able to regulate our emotions. So those are some of the basic skills that are trained in mindfulness training. But there's another important thing. So mostly I've just been focusing on the what we do, and that's the noticing, the awareness, the observing, the paying attention. But there's also how we do it, and how we do it is profoundly important as well. The way that we pay attention is not in a harsh, cold way, but in a curious and friendly way. It's with an open mind. It's in a kind way and in a non-judgmental way. And those two things together, the what we do and the how we do it, is what makes mindfulness a very powerful practice. Mindfulness is now being very widely used across many different domains, perhaps most of all in clinical settings, but increasingly in educations and organizations. It's also used a lot in sports, both with great individual athletes and with teams. And it's used in relationships, for instance, in mindful couple counseling. In certain specific contexts now as well. In prisons, there's been very effective use of mindfulness training, and in the military. Now, some people say, oh, but we don't want mindful soldiers who are just better at killing. And yes, that's certainly true, but one of the things that influences that affects people in the military is they work under conditions of enormous stress where they have to make very rapid and difficult decisions. And by learning mindfulness, they're better able to make the right decisions, the best decisions, and to deal with their stress and hopefully to reduce the PTSD when they return from service. So many different places that mindfulness is used. A particularly interesting application, I think, is mindful parenting. So if parents are better able to listen to their children, if they're not so reactive, if they listen with kindness, chances are they're going to be better parents. And although research is quite limited at the moment, there is very good evidence, particularly in kids who have a lot of difficulties, like kids with ADHD, that teaching the parents mindful parenting can have great benefits, both for the children's well-being and also for the well-being of the parents themselves and their relationship to each other. And these are just two of the books that describe this, but we do need a lot more research on this topic. Now, there's a particular group of people who I think you might all agree could really benefit from some of this mindfulness, and that's our politicians. And amazingly, there has been an experiment going on for a few years now in Britain in the Houses of Parliament, where every couple of months an 8-week mindfulness course is offered in Parliament to parliamentarians. And by now, perhaps a couple of hundred have been through this course. And the anecdotal evidence is that makes a great difference to the way they relate to other people, including people from other parties. Now, you know, there are many more than 200 people in Parliament, and perhaps many more of them could do with doing the course. But one of the benefits that's happened already is that there has been the creation of the All-Party Parliamentary Group on Mindfulness. And their aim is to get mindfulness into 4 main areas of policy. One is health, another is education, one is the prison service, and the last one is in I've forgotten what, probably into employment. And they're working very actively to find ways to introduce mindfulness training into these key areas of life. So I'd like to turn now to some of the evidence of the benefits of mindfulness. And here's a very recent review from a top journal looking only at the very best high-quality studies and what has been found. And as I mentioned, the evidence is very strong from clinical practice, from both mental and physical health, of the benefits of mindfulness training. So there are great reductions in the symptoms of depression and anxiety. There's also a reduced relapse rate of depression in patients who undertake mindfulness training. Also evidence of reductions in substance abuse. And in terms of physical health, mindfulness training is now very frequently recommended for the relief of chronic pain and also for stress. And in both these cases, the effects are on the subjective experience of pain and stress, and also the effects can be shown very clearly on physiological measures, showing reductions in areas, aspects of physiology and brain areas that are related to pain and stress. There's also evidence from cognitive and affective processes. So in terms of the cognitive processes, there are objective performance measures of attention and memory, showing that sustained attention and working memory are improved following mindfulness training. Not all areas of attention seem to be equally affected, and for instance, ability to shift attention doesn't seem to be so strongly influenced, but we need more research on that. There's also evidence of increased problem-solving ability using objective tasks, and that's an interesting one. And in terms of affect, lots of evidence of increased positive affect, and also increased ability to regulate emotions, absolutely central to our well-being. What about interpersonal processes? Well, there's evidence that mindfulness training improves the quality of our relationships, and a lot of this is done using daily diary studies. There's also evidence of a greater ability to take the perspective of another person, and evidence that following mindfulness training, we're more likely to do pro-social actions, helping people, for example. So this is quite strong evidence. There's also very good evidence from neuroscience, and the way this works is you put people into a brain scanner, a functional magnetic brain imaging scanner, and give them a short mindfulness induction. So tell them to focus on, for example, their experience of the breath coming in and going out, and they do that for a little while. And then we can look at what areas of the brain are particularly activated when they are practicing mindfulness as against some resting state. And here's what we find. Now, some of you will be very interested in the details of which brain regions are involved, but my main purpose in showing this slide is just to show that the brain regions that are involved are exactly the ones that we would expect. They're the ones to do with attentional control. They're the ones that are related to emotion regulation. And they're the areas that are associated with self-awareness. So again, very powerful evidence from neuroscience that mindfulness actually does produce effects in the brain exactly where we would expect them. Now, those studies are, if you like, looking at the mindful state and seeing what's happening right then in the activated brain. But a really interesting question is to say, how long does it take for mindfulness training to change profoundly the way we do things, the way we relate to our experiences, and the way we relate to the external world? Now, we know that the structure and function of our brains influence how we respond, but we also know that the way we think and act can change the structure and function of our brains in a permanent way. If we are constantly beating ourselves up and criticizing ourselves and saying, oh, look, we're no good, we're hopeless, we can't do it, we're going to fail, the brain pathways that underlie that kind of thinking get stronger and stronger. But if instead, through mindfulness training or CBT or other approaches, if instead we say things to ourselves like, well, look, it's hard, but I can do it. I'll give it a go. Maybe it'll work. I'll do my best. It'll be okay. Then the pathways that underlie those thoughts and processes get stronger and stronger. But my question here is, how long does it take before we can see changes in the brain structure? Is it months? Is it years? Well, the astonishing fact is that it is weeks. Just weeks to see changes in brain structure following a standard mindfulness-based stress reduction 8-week course. So the sorts of things that you can see are, again, exactly as we would expect. Changes in areas related to attention, learning, and memory. Changes in areas related to emotion regulation and to self-awareness. Also changes in areas about compassion, and also this term interoception, or bodily awareness. So at the end of a mere 8 weeks, we can already see increases in the grey matter density in those brain regions. So if any of you are thinking about doing such a course, I hope you may be encouraged by the very rapid rate at which our brains can change. And of course, the way our behaviour and attitudes can change for the better in this really rather short time. I want to turn now to a particular application of mindfulness, and that's in the area of education. Because if mindfulness training is so beneficial for so many basic skills and areas of our lives, then perhaps the sooner we do it, the better. And a lot of work has been done on mindfulness in an education setting. So here's the results of a couple of fairly recent overviews, again looking at, where possible, the best scientific evidence, although we can always get better evidence. But already some of the studies using randomized controlled trials, some using active control groups, already we can see very, very encouraging results. So there are improvements in cognitive skills. There's improvements in academic performance and in social skills. There's improvements in emotion regulation, that one again. Improvements in self-esteem. Also improved mood and decreases in stress and distress and fatigue. So it certainly seems to have benefits on students who learn mindfulness. I'm going to turn now to just one particular form of mindfulness training, which is called .B. Some of you may be familiar with it. It's one that we developed in the UK with a couple of brilliant teachers who really transformed the mindfulness-based cognitive therapy or mindfulness-based stress reduction techniques in a way that made them suitable for students. Students were in pairs in our initial studies. They had a buddy, and once a day they could send a message to their buddy, and this was the message, .B. And it was an instruction, stop, be, breathe, or just be. And adolescents, 14 and 15-year-olds, just loved it. Permission just to stop, just to be. And we found some beneficial effects of this training. So the initial studies were small, only about 150. It was all boys in this case. And there wasn't much difference between the mindfulness group and the control group, but that's probably because there were only 4 lessons. The boys complained that they weren't enough. But what we did find is within the mindfulness group, the important effect of practice. The more the students practiced, the more the benefits, and these were significantly so. So benefits on well-being measures, resilience measures, and mindfulness itself. We then listened to the boys, did a larger study, 9 lessons, not just 4, much larger sample, all sorts of schools around the UK. And what I'm going to show you now is just the differences between the mindfulness group and the matched control groups. First of all, on a measure of well-being immediately after the course, and then 3 months later. So this is well-being immediately after, not quite statistically significant, but definitely an improvement. A reduction in depression symptoms, highly significant, right after the course. What about 3 months later? Now that's a very interesting time. They're very stressed, students are, because they're about to do their exams. Now the difference in well-being is statistically significant. And there's still a significant reduction in depression symptoms. And that is very, very interesting results. Now, the one downside of this study was it wasn't randomized. And we're now doing a really huge study in the UK that I'm very proud to be part of, which is randomized. The first part of it is teacher training, because all this training is given by the students' own teachers, not people parachuted in. So there's a randomized approach to the teacher training, both their own personal practice and their learning of the curriculum. And then there's randomization of the student training as well, with follow-up over a couple of years. So watch this space. I think there'll be some very exciting results, and it's a very large study. What about in other applications? Teacher training itself. There is some evidence that the benefit for teachers is very large of mindfulness training. So on their own well-being, their classroom efficacy, their ability to manage classrooms. Also, and I think this last one is so important, their ability to develop and maintain really good relationships with students, because that's such a hugely important part of teaching. And beyond education, many organisations are now training their employees in mindfulness. We need many more good studies. There has been one recently in the Harvard Business Review showing some very good benefits, but it's only small. We just need bigger, better, well-controlled studies. And if any of you are working with organisations, please do consider contributing to this research literature. Oops, I'm so sorry. On the basis of all this, I'm suggesting that mindfulness is a foundation of well-being. I mean, what could really be more foundational than attention, awareness, emotion regulation? But there's another part of mindfulness that I've already mentioned, and that's self-compassion. It's the kindness part, the being gentle when you come back from your mind wandering. And Kristen Neff is the person most associated with work on self-compassion. And she talks about self-kindness, which is being as kind to yourself as you would be to a friend who's suffering. Not beating yourself up, not being harsh and critical, but being understanding, being kind, and also recognizing common humanity. Everybody has weaknesses and failures and makes mistakes. It's just part of what it's like to be human. Now, the evidence is that self-compassion does have benefits. So the first example is a large group of patients who have had many bouts of depression. And it turns out that mindfulness-based cognitive therapy reduces the relapse rate, but only if they have also learned self-compassion. Very important finding. The second one is evidence that self-compassion training can increase our happiness, and we know that happiness can have wonderful knock-on effects on functioning in other areas of our lives. And the final one I think is fascinating, that self-compassion training leads us to be motivated to change behaviour for the better. So to come at behaviour change not from a harsh place, oh, I must, exercise more often, but rather from a kind place. I really care about my health, and that's why I would like to change. To come from a kind place seems to have great benefits. I'm going to turn now just briefly in compassion towards others. And one of the things I need to talk about here is what's the relationship between empathy and compassion? Now, empathy is the shared feeling of another's pain, and it seems to be hardwired. We just automatically respond when someone else is suffering. That's empathy. And empathy is a wonderful thing, but it doesn't always happen. There are instances where if someone hasn't been nice to you, you don't care about them. There's also some evidence from recent studies by David Eagleman and others that if you watch someone getting a jab, you have as much arousal in the pain pathways as if you were experiencing it yourself, unless you see them as members of an outgroup. And so this very same experiment, watching people have their hand jabbed, has very different effects according to what label goes with that hand. So if they're members of your group, you do get a strong pain response in the areas of brain where pain is felt, or where the affective areas of the brain. But if they're members of an outgroup, then that response can be greatly reduced or even eliminated. Now, it's not true for everybody. There are many people for whom the empathic response to pain is just as great for the outgroup, and thank goodness for that, because we really do need to be concerned about all of humanity and not just the people who are like us. So empathy and compassion are different. Empathy is sharing someone's pain. Compassion is feeling for them. It's the sense of warmth, care, and concern that you feel for someone who's suffering, and the real motivation to help. And again, the scientific evidence about the difference is very clear. When we're in empathy, we have negative feelings. It's hard to be experiencing someone else's pain. We're thinking about ourselves, oriented to ourselves, and we might withdraw from the situation. And staying in empathy too long can lead to burnout. Compassion is different. In compassion, we have positive feelings of warmth towards the other person. We're thinking about the other person, not ourselves. We're approach-oriented, wanting to help, and it leads to good health. And the neuroscience is also very interesting on this. If you look at the areas that are activated when people are instructed in an empathic way versus a compassionate way, in an empathic way, you can see activation in the mirror neurons of the brain and other areas that lead to us understanding what's in someone else's mind, activation in areas to do with negative affect, and activation in some of these integration areas to do with bodily awareness. In the case of compassion, on the other hand, there's activation in the affiliative areas that relate to relationships and bonding and so on. In positive affect areas, and interestingly enough, reward areas of the brain are activated when we experience compassion. And the actual areas of the brain that are activated are very different in empathy compared to compassion. There's just no overlap between the two. So we probably do need compassion to get into empathy. I'm sorry, the other way around. We need empathy to get into compassion, but it's compassion that is the important and healthy response. And what are the effects of compassion training? A large review, including some very lovely work by Barbara Fredrickson, has concluded that there's benefits in these 5 areas. One is benefits for positive and negative affect, psychological distress is reduced, there's positive thinking, and also, as we would hope, interpersonal benefits. There's also a greater ability to do the mind in the eye test, look at somebody's eyes and know what it is they're feeling. So very clear benefits. And just a couple of examples before I close. One is a very lovely but quite small study done by Davidson and his colleagues in Wisconsin with preschool children, and some really impressive benefits. There are benefits to social performance, as one might expect, but also to cognitive flexibility, and fascinatingly to delayed gratification. A way of resisting temptation, which is associated with many, many good outcomes in adulthood, as many of you will know from the famous marshmallow studies. Another example, and this is teaching compassionate discipline to teachers in an online form. Again, many great benefits of this approach to compassion for the students, much reduced rate of suspension and more engagement with learning and more respect for the teacher. Finally, I just want to mention a very impressive study that's going on in Israel, and there, as you know, there are a lot of tensions between Jews and Arabs, and this is a training program for Israeli teachers to reduce stereotype and prejudice. And the effects are very powerful. If you look on the right-hand side of each of the bar charts, that's the control group, and you see very little change in the control groups who have not had the teacher training. But the others show very marked effects. Much more willingness to interact with the other, many fewer negative feelings, and much less prejudice towards the other. And in our world where there is so much of people being in their own little in-group bubbles, not knowing the other, possibly fearing the other, these kind of interventions are becoming profoundly important. So just to conclude, I believe that with this kind of program, with mindfulness and compassion programs, we have a real opportunity to shift the mental health spectrum towards flourishing. Now, we know from the study of epidemiology, or the study of populations, that for any common condition, such as these common mental disorders, depression, anxiety, the most powerful way to reduce the disorder is to make a tiny shift in the average in the population. And that's what we're hoping to do here. Let's see what would happen. A tiny shift in the direction of increasing the psychological resources of people through mindfulness and compassion training, whether it's in education, at home, in organizations. Let's see what a tiny shift could, in theory, do at the population level. So you see, if we look at that light grey curve, the prevalence of the common disorder is way less down there in the tail, and the prevalence of flourishing is way higher. So that's the hope, and I would just like to conclude. I see mindfulness and compassion as the two foundations of well-being. Mindfulness gives us an open mind, compassion, an open heart. And there is a link between them. Open minds lead to open hearts, and open hearts can also open our minds. And together, these two foundations lead to wise action. And wise action generated from mindfulness and compassion, I think, can be very, very important, foundational to our individual well-being. As the evidence suggests, it's also important to our relational well-being. And finally, as more and more studies are starting to show effects on in-groups, out-groups, tolerance, lack of prejudice, lack of stereotyping, societal well-being. So I believe mindfulness and compassion training can have these tremendous benefits for individuals, interpersonal relationships, and for society as a whole. Thank you.
Felicia, thank you. Thank you. If you're just joining us, you just heard, or you're hearing from Felicia Huppert on mindfulness and compassion as foundations to well-being. Felicia, what a wonderful presentation. Thank you so much. It was absolutely terrific.
Thank you.
Yeah, you're welcome. And what was very impressive, too, for those of us behind the scenes, the amount of material you were able to pull together in one presentation was quite impressive. So well done you. And you can take a breath and have a sip of tea or orange juice, since it's early in the morning for you in Australia. Just a tip of the hat to all of you around the world. We sure appreciate you being with us, whether it's early in the morning or late at night or midday. We just appreciate you being a part of this. We have some questions that are coming in. Felicia, if you're good for some questions, I'll put some forward to you.
Yeah, sure, love to.
Okay, that's awesome. I do have to say, though, I was thinking how lucky all of us are to have listened to you today and learned from you. And I was just thinking, boy, when you were talking about Parliament and corporations, I was just thinking, boy, wouldn't this have been great if millions of people could have heard your presentation. So we'll get on that and let you know how that goes. All right, so let's go to the first question. Good question from, let's see, this is going to be from Nadine Meller. And she asks, what evidence do we have, Felicia, for leaders making better decisions as a result of mindfulness? Do we have that?
There is a great deal of interest in this area, teaching mindful leadership. But as yet, as I mentioned briefly, as yet, the research is lagging far behind. That small study from the Harvard Business Review, which is, by the way, currently under peer review to go into a journal, is an example where they probably are making better decisions in the sense that that they were able to lead in more complex situations. But we don't have good research evidence yet of this. Now, of course, if there's evidence out there that you may know about and I don't, please send it in, because it's very important for us to be gathering this kind of evidence. And if you're in a position yourselves to collect such evidence, particularly, you know, large, good quality studies, ideally with randomization, ideally with active control conditions, then we can really start to get a handle on the benefits for leaders and for other groups as well.
That's terrific. You know, for any of you who are researchers, you just heard there an opportunity and an invitation to do research in this area, and Felicia is very interested. So that's why we founded this program here, is to create opportunities for practitioners and researchers all to get the same information hot from the leader's mouth. So thank you, Felicia, for that. Another question comes from Denmark. Luis asks a question: has research found any major differences in the benefits of mindfulness as it is experienced by children, adolescents, and adults? You touched on that, but if you could talk more, that would be great.
I think in terms of the basic skills that I was talking about, they would apply across the board, I think right across the lifespan. I think what's extremely important, of course, is to make sure that the training that is given is age appropriate. And I mentioned the .B program that was developed for adolescents, but there's now a program that's been developed for primary school children called Pause B, and an even younger group of people, pre-primary, kindergarten children, has been developed. So we're talking about 3-year-old and up. Mindfulness programs that help them initially with relaxation, with getting in touch with their bodies, with noticing their breath, that have a very calming influence. And it's probably going to take a while before they get really in touch with their thoughts, but they're well on the way if they start these things early.
That's terrific. Another question comes in, Felicia, from Lyle Baker, and the question is: do you, Felicia, know of any research on mindfulness training with law students?
With law students.
Yes.
I know of an ongoing program, but I don't actually know of any research. And it's a very good question, because lawyers are certainly among the most stressed members of our society, and there's very, very high rates of suicide among young lawyers, law students as well. So it is much needed. Yes, I would certainly advocate more studies teaching mindfulness to law students and undertaking good research and evaluation on it.
Oh, that's terrific. Again, this is the call to be on. There are some real good suggestions for research, and a number of questions came in around research, Felicia, and so we've sort of summarized it in this question. Because there are students and researchers on the webinar right now with us, what suggestions, Felicia, would you have for them regarding future avenues for mindfulness or compassion research?
Regarding future evidence, did you say?
In this case, future research that, future avenues for research that you might suggest that on mindfulness and compassion. Anything in particular that we might additionally encourage our researching community to look into?
Right. Actually, there's a very real sense in which the two are very, very closely related. I think I've presented this a little bit as if there's mindfulness on the one hand, compassion on the other. But in fact, as I mentioned, mindfulness training incorporates at least self-compassion. And increasingly in mindfulness courses around the world, there are now explicit sessions on compassion towards others. So there's becoming much more of an integrated approach where both mindfulness and compassion are being taught. And that teaching can be used, I think, very broadly. I put up that list earlier in clinical settings, in schools, organizations, also in those special settings, in things like prisons and military. I think the law students is a very good example of a special setting. More work being done with parents and with teachers. And Also, we need better measures. A lot of the work relies on self-report measures, but increasingly we're trying to get measures of actual performance. Is pro-social behavior, behavior that we can measure, actually being improved? And there are now lovely efforts to look at objective measures of such behaviors. For instance, will you help a person in need who comes into a waiting room, on a pair of crutches? Will you give up your seat for them? And things like that. So I think there's real scope to think about how we can measure some of these things in a more objective way and go beyond the self-report scales.
That's terrific. That's terrific. Two questions for you. One is the magic wand question, and that is, if we gave you a magic wand, Felicia, and you could wave it across the entire globe, and one thing and with that wave of the magic wand, you could ask every person on the planet to do one thing regarding compassion or mindfulness, what might that be? Big question.
It is a big question, and I think what it would be about is trying to understand what it's like to be in somebody's shoes, not necessarily suffering with them, but having an understanding of what life might be like for them. Because only in that way can we really help them and can we really make change. And of course, when we do help others, we are helping ourselves. And that's one of the remarkable things, I think, in the neuroscience literature. When we experience compassion, automatically the reward centers of our brains are being activated. So we're not just being nice to people, because it's the right thing to do, but actually being kind, being compassionate is not only good for people, for society, but it's also good for us as individuals.
That's terrific. That's terrific. We have one more question. We have more, but we have time for one more question, and this one's more on a personal nature, and that is, Felicia. Many of us are, we aspire to have the impact that you've had in your career around the world, and you could choose to focus on really nearly anything and make an impact. What could you tell us about your personal connection to this subject of mindfulness and compassion? What drew you to this? Tell us a little bit more about what drew you to the work.
Well, interestingly enough, it was the work I did with the UK government on that Foresight project on mental capital and well-being. I was asked to summarise all of the well-being evidence, and I kept coming across this thing called mindfulness, and I was pretty impressed by the evidence of the wide-ranging benefits of mindfulness across many conditions, many ages, and so forth. So I came to mindfulness purely through the science. And on one occasion, I was invited to a very famous school in the UK, Wellington College, set up by the Duke of Wellington for the children of the military. And it used to be famous for its bullying, but they had a new headmaster, and he introduced happiness lessons. And I was on a panel at the first meeting that they had, and I was asked this very question: if you only had enough money to do one thing to improve the well-being of students, what would it be? And I said, well, just based purely on the research and evidence, I would say teach them mindfulness. And if anyone wants to do research on this, come and see me afterwards. And that's what led to the Mindfulness in Schools project and the .B and so forth. So it was only many years later, after I'd been involved in developing mindfulness programs and so on, it was only many years later that the penny dropped, and I thought, you know what, maybe I should try it. Wow. And so I signed up for a mindfulness-based stress reduction course and found it absolutely superb. I was really bowled over by the quality of the teaching, the quality of the curriculum, and the effects it had on so many areas of my life. And I wouldn't say that I practice every day, though I tried to, and sometimes it's only a few snatched minutes, but it's always there. It's always there, and it can always make a difference to both how I save a life, how anyone saves a life, but also how to deal with things that are difficult in your lives. It's always there.
Wow. Wow, what a wonderful, wonderful way to close up our time with you today. What a wonderful, wonderful to hear your personal connection to the subject. And you said something, you've touched on it right now, and you said it during the presentation that just, I think, liberated a lot of us. And that is, yes, it's great if you have time to sit down for an hour or a half hour or 15 minutes, but even a couple minutes of mindfulness, meditation, and compassion, boy, that can make a difference in our lives and make a difference in our communities and the world. And I, on behalf of the International Positive Psychology Association, thank you for that.
Thank you very much, David.
Yeah, you're very welcome. That was really great to have you, Felicia. Wonderful the work you're doing. And just so that everyone knows again, you've been with Felicia Huppert, and we've been talking about mindfulness and compassion as foundations to well-being. And the recording of this webinar will be online at the beginning of next week. You'll see Felicia's presentation, which was just awesome, as well as hearing the audio. So if you're going to be like me, going back and taking notes, that's the way to do it. A couple things real quick, just to say congratulations to Judy Eaton from Hamilton, Ontario. She was the first person who answered the question, where is the 5th World Congress in Positive Psychology going to be held? And the answer is Montreal. And congratulations to her. We'll be getting a book out to her of The Law of the Garbage Truck. And also wanted to let you know that Everett Worthington, best known for his work on forgiveness, is our next presenter in the series, and that's on March 15th. And he'll be talking about humble leaders in business, religious, and political contexts. Boy, it's going to be a great program. So finally, I just want to say thank you. I want to thank our Executive Director, James Pawlowski, for his support over these 10 years. Without James, there would be no program. He just was great, as always, and for those of you who know him. His work as volunteer, it's hard to believe, but his volunteer work has made a huge difference in the world, as well as our President, Barbara Fredrickson, and her continued leadership in the field. Our producer of the series, who I mentioned at the beginning, it just does so much work behind the scenes to bring this program to you. That's Jenny Brennan, and she's also just a super person. Our technical and social media director, Sydney Rubin, another wonderful individual who makes things happen behind the scenes. I want to thank them both. And finally, I want to thank you again for joining us. I'm David J. Paulé. Wherever you are in the world, thank you for making a difference through your work on positive psychology. Go have fun doing a little meditation, and we send you all the best. Goodbye, good day, good night.